gotten a lot of great feedback about the dashboard, the Escambia County COVID-19 dashboard that your team put together along with our webmaster.
Yes.
And tell us a little bit about what we're seeing and what the data means.
Good deal. So what we have behind me is the Escambia County dashboard, and it was put together at the county commissioners wanted to have a place where we could go to one spot and see the Escambia County snapshot. What do we look like day to day? This information is all out there. It's just in multiple places. You got FDOH, you got ACA, you've got other sites that we're pulling data from. So this isn't anything that we're producing ourselves. It's just we're reaching out there, we're grabbing it for Escambia, and we're putting it in one spot so you can see it. So we'll drive through the dashboard real quick. In the upper left-hand corner, we've got our total cases for Escambia County, and then the tabs below, we do have the residents and non-residents. So you can break it out, residents and non-residents. We do have non-residents coming into the county that are testing. Some of our testing sites allow anybody to get a test, Florida resident or not. Some of our testing sites are Florida residents only.
And this is cumulative. It's not a snapshot
That
in
is
time.
correct. That is correct. This is cumulative. So this is as our cases increase, that will stay. That'll be on a steady decline as we go throughout. Absolutely.
And right now, Florida doesn't have a way to remove those who have recovered. Correct?
Right. There is no definition for recovered. I have asked DOH, and DOH is actually in talks with CDC. I did get confirmation this week that they're in talks with CDC to try to come up with a recovered definition, and I'm hoping that they do, because that number looks daunting right there. And you know, we know people have recovered. We know people have had it. Sure, many people have had a family member, or know a relative or a friend that have had it and recovered from it themselves after their 2 weeks and they're back at work. But that number is daunting, so we are trying to get that worked out. Hopefully, the state can get that going. So, the next box over, we have our residential deaths. How many deaths have occurred in Escambia County? And then we have our non-resident deaths. Our hospitals are a regional system, so we do have residents from Escambia, Alabama, Baldwin County, Alabama. So it would include residents and non-residents. So we do have a lot of people from outside Escambia County in our hospital system. We also have our mortality chart, which starts back in March, so you can see where the deaths occurred through which months, and then another line graph, daily COVID deaths. It doesn't break it down, but you have to just kind of estimate which days it is at the beginning of the month, at the end of the month. So, but we do have our total residents.
The nice thing is it shows a trend, right?
Shows a trend
over time.
That's what we're trying to show, is a trend. So you're not going to actually see 5 deaths this day, or it's a trend over time. Exactly. We go over to our next box. It's a total test done in Escambia County. That's just a number that's going to be cumulative as well as it rolls up. And then we have our total residents negative in Escambia County, cumulative once again. We get down to the middle row on the left side, we have our cases per day, and it'll show you the trending as it goes through the days, through starting in July 7th, and it's a cumulative rolling. And then we have our tabs at the bottom that you can go through the demographics. So our median age right now is 37 persons with COVID-19. Cases by age, cases by gender, male, female, cases by race, and in cases by ethnicity. So we do have our demographics broke down in that one that you can get more information from.
Now, sometimes the numbers will jump, and I've heard that's because there might be a data dump,
right?
For lack of a better terminology, that there's more data that was put in the system on a certain day. It doesn't necessarily mean that that day was a bad day. Is that correct?
That is correct. Once again, this is FDOH's data. So once they have a data dump, it will reflect on our board, and it looks daunting, but it is a data dump. They just all come in at one time, and you'll get them dumped at one time. So as I said, we're not making this up ourselves. We're pulling from what FDOH does, and they do have that from time to time happen. Absolutely. Good point. Thank you, Laura. In the middle of the screen, we have our current COVID hospitalizations as of today. Understand that is just a snapshot. If we can go back to that tab, it's just a snapshot of today. And that's real. That's what we have in the hospitals right now. Those are COVID-19 patients in the hospital, not necessarily all in ICU beds, not necessarily all on vents, just what's occupying the hospitals right now. And then the tab at the bottom, we have our daily hospitalizations, and we have been on a steady incline of our hospitalizations here lately. The hospitals, we have our weekly call with the hospitals. We have it every Monday, and as of yesterday, the hospitals said they seem to be doing They're good still. The last week there was a little bit of concern of staffing, but staffing seems to be they're coming back online. They're testing negative now, so they're getting their staffing. They still have bed availability. They still have resources available, so they feel like they're okay still at this point. Then we also have added. So what's added to this is the next tab is ventilators. So we give you the total ventilators and how many are used and how many are available. And once again, we're grabbing this information straight off what the hospitals are giving us. So,
And this data helps our commissioners or other elected officials and public health officials make decisions on
Yes.
what might need to happen later or what needs to happen at this point in time. So you're always keeping a pulse
yes,
on what's happening with our hospitals, which is reassuring to me, that you're having that constant communication and knowing what's happening. And I think with the contact tracing, what we're seeing, I think what most employers are seeing is that folks are being careful, right? And they're going out so that they don't possibly infect somebody else.
Right.
So the staffing levels can be challenging sometimes, but it's a safety measure.
it is a safety measure. You're absolutely right. So the hospitals have been great partners. They're going to tell us what's happening in the community. They're going to tell us if we're having major issues, if we're running out of ventilators, or we're having major issues in the hospitals. That's where we're going to see. That's where we're going to have our first red flag, and it's going to show us that we're having issues, and that'll give the county commissioners and other elected officials an idea of what we need to do next or implement next to either pull back, make more stringent, or make decisions to curtail the increase of COVID-19. So absolutely. Our box to the right of the total ventilators is total hospital beds available. We have 389 beds available in Escambia County. And we can scroll through and see each individual hospital, how many beds are available at each individual hospital. The next tab over is ICU beds that are available. And you can scroll once again to see which hospitals have the ICU beds available.
Now that number looks scary. You see 0 and you get scared, or you see headlines that say there's 0 ICU beds. What are we going to do? So you've had multiple conversations with
Yes.
the hospitals, and so tell the viewers what a surge plan is and what that means.
So a surge plan is where all hospitals have a surge plan, that if they run out of ICU beds, it's not a special bed per se, it's the equipment that you place around the bed. So they have enough equipment, enough ventilators, as we saw in the previous tab, that we still have 129 ventilators available, that we can put that specialized equipment around those beds to increase ICU bed availability. So they have only so many licensed ICU beds, but during a disaster, we can make any bed pretty much into an ICU bed by putting the proper equipment and personnel around it. Then we have at the bottom, we have our current positivity rate, and to note that it is a weekly. So it is a weekly. It's not a cumulative running. It is each week our current positivity rate. And then we also have our graphs off to the side so you can see beyond the weeks. So we have our positivity rate per week broken down back from March 1st when we started doing this. And then our testing per week and our negatives and our positives. So you can see our trending lines for our negatives, which is the orange line, and the yellows for the positives.
Thank you, Eric. I really appreciate it. This was very valuable.